Hey guys, what's going on? I'm Combat Craig, and today we're talking about some problems, big problems, with vet centers. One vet center in particular, but it's a bigger problem than one. And it does involve mental health, PTSD, and suicide. And so it has a lot of bad components to it. And I have Benjamin Krause with me here today to help walk us through it so you're aware of it. What's up, man?
Hey, man, thanks for having me on.
Thanks for being here.
Yeah, well, so today we're going to talk about vet centers, and apparently they've been sucking lately. So we need to get into that so veterans understand, so family members understand. And, if you've been going to a vet center and you feel like they haven't really given you the care that you need for PTSD, you're in good company. Apparently it's a problem all across the country where the VA officials are downplaying PTSD and suicide. So veterans who are,
Say it ain't so. The
rumor
VA
has it.
Yeah.
Rumor has it. So they've been basically going full on with how they've been doing the diagnosis or misdiagnosis. And apparently this is going on because they don't want to get in trouble because of what's happening up in like higher echelon VA, right? So that's kind of the general gist of it. And in one case, it came up in 2020, during the big schmamdemic, and everybody, wasn't able to get in to see your doctor. Well, apparently one veteran had sadly ended his life over in Indiana at the South Bend Vet Center. That spouse ended up just getting a settlement of a 1.7 million, which will never, it'll never make her whole again. But on the other hand, it'll at least help a little bit. Her kids, will be able to go to college and whatnot. But wow,
it'll help substantially. And this is like you were saying, this isn't isolated. This happens. And I'd say a majority of spouses in this situation, there's nothing probably. If they don't have.
Right. And so in this case, what they found out is that apparently across the VA, but also at this South Bend, Indiana location, that at the vet center, the senior leader there, the vet center director, had been instructing their staff to underreport suicidal veteran symptoms. So if you were there trying to get help for suicide, not only were you able to not be seen by apparently a proper licensed professional, at least in this case, and the interns and everybody else were apparently too afraid to properly diagnose. And so this poor veteran, after trying to get help for about 6 months, ended up, death by suicide. And, it now only, 4 years later, 3 years later, we finally getting to the bottom of it with vet centers and what appears to be happening nationwide. Congress just had a hearing on this back in February, but it's a big problem. Now, at least we know at the end of the story, after filing what's called a Federal Tort Claims Act, the family was able to get at least some degree of help, to move forward. But man,
can you repeat that again? And it's not an 1151 claim; it's different, right?
No, right. It's different. So in VA land, if you are a victim of injury because of a misdiagnosis or some other kind of negligent tort, you can file suit in a very limited, narrow window. Within 2 years, you have to file what's called a SF Standard Form 95, and that has to articulate more or less what happened, and you have to submit it to the agency in time to make sure that you get the type of recovery that you should be entitled to. But basically, you have to submit the form, they'll adjudicate, and if they don't give you a reasonable resolution, you can then sue. And that's the only time you can sue. And if you don't do it in time, you cannot sue. Like that's it. Very
Another
small
window. Mm-hmm. At least it's actually a window. I'm sure that didn't exist for a period of time.
Right. It's better. It's better than
zero. I mean, thinking about, how to go about this, and it is definitely way more complicated than a VA claim. Let me jump in here real quick and tell you about my boot camp. If you want to learn more about the VA claims process, check out my boot camp. You can talk to me live. There's a link on the website and in the description, combatcraig.com. And also, if you need medical evidence like a nexus or documenting your symptoms properly, Go to our website, combatcraig.com, and it says medteam/Nexus letters. Click on that link, fill out the form. Boom, you're done. I wanted to back up just a little bit on the underdiagnosing part, especially when it comes to talking about suicide. That's something that I'm just aware of. I've never had an intent or plan, but I also understand what those words mean, and they can mean cops showing up at your door if you're, not careful. So you said somebody was like an intern, were they just not even qualified at all, or the system clearly failed all the way through, and he did have intent for sure,
Mm-hmm.
and a plan actually probably, and that didn't get eased up, and that's something the VA is looking for. So they fell down on that too. Anything is possible.
They failed big time, and then they falsified records to try to evade accountability in addition to that. And so the person was an unlicensed intern that was managing the guy's, mental health care, and he was obviously suicidal.
Unlicensed? Was he like a social worker or just some dude?
I'm not clear. Probably a social worker.
Unlicensed, right? Not board certified psychologist or psychiatrist for sure.
Probably a social worker. And then in addition to that, the guy couldn't get in to be seen in person, and that was a problem. So he's only getting access to somebody over the phone. And then in addition to that, when that unlicensed intern left, the person that took the case over also blew it. And then when the veteran did, commit suicide, the new individual then tried to cover it up and make it look like they had done everything they could do to help the veteran and that it was the veteran's fault. And so the whistleblowers apparently came forward. So it was like a really big thing.
That's amazing. And you're right. That sure it is now, or like whatever bug is going around at whatever time. Definitely when you're getting into those most serious parts of mental health conditions, and intent and or plan, or both specifically, that just doesn't come across as well online. I was in person when I was in that spot, and it's just there's just, you're over there wherever you are. I can convince you of a lot of things, but seeing the pains
it's not the same vibe. And then, we know that the VA is trying to experiment in a way with telehealth because this is the new thing.
Let me jump in here real quick and tell you about my boot camp. If you want to learn more about the VA claims process, check out my boot camp. You can talk to me live. There's a link on the website and in the description, combatcraig.com. And also, if you need medical evidence like a nexus or documenting your symptoms properly, go to our website, combatcraig.com, and it says medteam/Nexus letters. Click on that link, fill out the form. Boom, you're done.
Well, so going back to this, so basically, the point and the reason I brought this to your attention was that the problem with access, especially when you're in distress, is significant. And even though we're kind of through whatever was going on between 2020 to 2022, and you can finally go in to see a healthcare provider in person,
you still can't.
Well, yeah, it depends on.
Not all the time, but it still happens. They've adopted healthcare or telehealth.
Yeah, and so there's going to be. So my theory here is that there are a lot of cases similar to this where veterans should, and I wasn't fully aware of the scope of this problem, but I would bet that there's probably a lot of veteran families out there. And if you happen to know of somebody who is running into this issue where the veteran did commit suicide or was injured because they didn't get access to timely mental health care, you must immediately file, the family must immediately file, or the whoever the conservator is or whoever, the veteran, if the veteran's still alive, must immediately file an SF-95 with the agency to preserve their rights. You only have 2 years to do that, and if you miss that window, it's gone forever.
It definitely seems a lot longer than 90 days or 60 days, some of the dates or various dates you have in the appeals process. But if you're dealing with it, you don't know anything about the VA, 2 years has gone quick. So that's seeing this has to deal with it. But if you know somebody, whatever.
Well, 100%. So I guess the point is here, we want to make sure that VA is held accountable, right? Yeah. So at the end of the day, that's what I do as much as I can. both as a journalist and as an attorney.
You
Cases
do it,
like,
I do it. We're
yeah,
going to continue to do it until the day we die.
right.
And we're going
Because
to like it.
I don't have
it
anything else to do. This is my
right.
hill. You know?
And this is my hill as well. That's why we get
Mm-hmm.
along so well. One of many
Yeah,
reasons.
yeah. Well,
And we actually have the First Amendment, and it's something you and I fought for, so they
mm-hmm.
don't have to like it. Let me jump in here real quick and tell you about my boot camp. If you want to learn more about the VA claims process, check out my boot camp. You can talk to me live. There's a link on the website and in the description, combatcraig.com. And also, if you need medical evidence like a nexus or documenting your symptoms properly, go to our website, combatcraig.com, and it says medteam/nexus letters. Click on that link, fill out the form. Boom, you're done.
Right. And so in this instance, they engaged in some wrongful behavior, and there's no question about it. The whistleblower, brought this to their attention. Oh, and by the way, the Office of Inspector General also investigated it, right? So when you get up to that point, when the IG is looking into it, and I've had a case similar to this in the past where we were successful, when it gets so bad that the IG is starting to dig and they want to know, more, that you hit a nerve within the VA. It's not
Did they
just
publish that, by the way?
what's that?
Did they publish the report and the findings?
Not always. So the IG report did publish a lot of information. I think that there's a lot of information that they
we can find it, and if anybody wants it, we can put a link in the description. Was my point. If you want to
published
look at this. Okay.
published in 2023, the report. And then I'm going to write about this too on disabledveterans.org because not just the story, but I wanted to extrapolate on what the IG is looking into right now from their hearing back in February of this year. Because again, this affects millions of veterans that go to these vet centers. And if you're relying on the vet center to give you the type of, help and support that you think that they're supposed to give you, be careful, because you may not be getting everything that you think you're getting. Now, one thing that really
the ability to keep living would be, I mean, it's sad, but
well, most people, would think that would be the rule and not the exception. And one of the things that I noticed in the reporting on this were comments from Senator Tester out of Montana. And so Senator Tester, what he was commenting on, he's like, well, this is where he wrote, and I'll quote this, quote, "People can let their hair down and talk to other veterans there," end quote. This is what Tester says. And then he's commenting on veterans having the option to go here for mental health care, and essentially that they like it, right? And other senators also were commenting on this. Usually one that comes to the aid of vet centers or VA employees do tend to be, Democratic senators and congressmen. But what I noticed,
it's funny. I've seen Tester. He can't let his hair down. Like it.
Tester is like a cheerleader, man.
I am, but doesn't have much. Now you have locks. You could do that if you want to.
I have some dreads. I could do it. And so they're just saying basically that, people like it, blah, 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 and they're really not as, they're always kind of like, oh, well, but veterans like it. It's like, what about this family here? The Moon family that's minus a dad. That guy was a chief warrant officer and Black Hawk pilot, right? So it's not like, I mean, and nothing against the rest of us, normal enlisted guys, but
more importantly, dad. Yeah.
Yeah, just more of us fall into this prolate camp having these issues than the other. And so he was a chief warrant officer, Black Hawk pilot, really traumatized and struggled with what he saw in Iraq. And it followed him to the grave. And VA then tried to cover it up. Thankfully, God, had in his providence to expose this scandal. And now it's affecting vet centers all across the country have been doing this. And it's confirmed.
And this wasn't, and the whoever interacted wasn't the VA OIG. It was specifically a whistleblower. Like somebody had to step up and rat this out.
Yeah,
it had to be done to change. That's awesome.
Yeah. So the whistleblower, real quick. So the whistleblowers basically came out. They told everybody that it was being mismanaged and that it was a bad problem. And they explained that the director had instructed people to actually underdiagnose or misdiagnose veterans' PTSD symptoms and not even really address it, or make sure that it comes down as low. So we don't want them to come in as medium or high, because then the higher ups in DC might get mad and they might come to, sniff around. So we want to make sure that they think that veterans are doing great. And
there's that, like, that is there, like, everywhere at every level, a degree of that. I've seen better or worse, and I just know this. That's why, that's one of many reasons. But yeah, the worse you are, the more they're actually married to you and should be checking on you more, or whatever. Mm-hmm. It's probably, Let me jump in here real quick and tell you about my boot camp. If you want to learn more about the VA claims process, check out my boot camp. You can talk to me live. There's a link on the website and in the description, combatcraig.com. And also, if you need medical evidence like a nexus or documenting your symptoms properly, go to our website, combatcraig.com, and it says medteam/nexus letters. Click on that link, fill out the form. Boom, you're done. All right, cool, man. Thanks for shedding some light on tort claims, 1151 claims, and just this system and the Moon family. That's horrible. It shouldn't happen. It does happen. There are ways to deal with it. And if you're in this case, you should definitely be looking into it. And there's words I don't like. So this is a good place where you would want to lawyer up. Ben, where can people find you if they want to reach out to you and say hi?
Yeah, no problem. So if they want to reach out and they have a question about this kind of stuff, which is super nuanced, they can get a hold of me at benjaminkrauselaw.com. And I've done these types of handled similar issues. This is probably the saddest thing I've seen, where the suicide related to vet center care, but
everything failed. The intent and the plan was meaningless.
Yeah, totally failed. Yeah. So this is definitely big boy land. So you need competent help to walk through these types of issues. You definitely don't want to, blow the opportunity to at least redress it as best you can and get some justice for your loved one. So, it's super important. But anyway, yeah, just reach out if anyone has questions about it. Hit me up.
And then competent help that will dovetail nicely into most of the time in VA claim world. You can do this stuff yourself. No matter who you hire, you have your own best interest in mind. The 1151 claims and tort claims are different. The lawyer will have your best interest in mind at that level. But most of the time, you just need to learn about the process. If you want to learn more, check out my bootcamp at combatcraig.com. And if you were denied or you're wondering about something, I'll tell you the answer right now. You're missing medical evidence 100%. You did not establish service connection. You need a diagnosis, current symptoms, and a nexus that links it all together. Go to my website. If you can't find a doctor to do this, my med team might be able to help you out. combatcraig.com. Thanks for joining me today, and we'll see you in the next video.